Lung 1 is 1 sun inferior and slightly lateral to lung 2. To find the 1 sun, find the width of an intercostal space close to the sternum and transfer it over. Stomach 20 is 2 sun lateral to the midline, 5 sun superior to the centre of the umbilicus at the level of Ren 13,
Stomach 44 is located half a sun proximal to the web margin between the second and third toes. This point should fit nicely into the flare of the base of the proximal phalange of the second toe. Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Stomach 38 is located 8 sun superior to the prominence of the lateral malleolus and 1 finger breadth lateral to the anterior crest of the tibia. This makes it halfway between stomach 40 and the anterior crest of the tibia. Stomach 37 is located 10 sun superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Gallbladder 36 is located 7 sun superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're having difficulty locating the anterior border of the fibula, just raise the leg slightly off the bed to allow the flesh to move away from the bone. This should make it easy to locate your point. Gallbladder 37 is located 5 sun superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Spleen 6 is located 3 sun superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Spleen 7 is located 6 sun superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having difficulty identifying the medial crest of the tibia, just raise the leg slightly and the flesh will fall away from the bone. Remember, it's half of your patient's finger breadth, not your own. Bladder 37 is located 8 cm superior to bladder 40 on a line joining bladder 40 to bladder 36. There's 14 cm between these 2 points, so that means the bladder 37 is just over halfway. Bladder 55 is located 2 cm inferior to bladder 40 on the posterior midline of the leg, in between the two bellies of the gastrocnemius muscle. Gallbladder 35 is located 7 cm superior to the prominence of the lateral malleolus. It's at the posterior border of the fibula. If you can't find the posterior border of the fibula, raise the foot slightly to allow the flesh to drop away from the bone. This point is on the same level as gallbladder 36, but posterior to it.